This claim right here says this death could have been prevented, but it also says there were as many as 10 other deaths recently at the Clarksburg VA similar to this homicide. That's right, new data suggests overdose deaths are on the decline in West Virginia, but some counties in our area aren't seeing that same progress. New information now staying in Marion County. Two cousins charged in a November murder were formally indicted today by a grand jury. Cynthia, good evening. To get a sense at just how serious this crash was here on Route 250, it happened around 9 a.m. and crews just reopened the highway here about 45 minutes ago. But if we cross over into the eastern part of Doddridge County, residents here are expected to live 23 years longer, to age 86. We are in Niagara Falls here on the Canadian side. You can see the United States right over here. Now, insulin north of the border where we are standing is 1/10 of the cost that it is right over there in the United States. That's why a local group is planning a trip here soon to save money on their life-saving medication. We're back with that breaking news alert we mentioned at the beginning of the broadcast. West Virginia State Police are looking for a missing 6-year-old from Webster County. I want to turn to WDTV's Rachel Ramsey, who's live in Mon County with more details on the search. Rachel, good evening. Cynthia, we can expect a full house. As you can see behind me outside council chambers, it's already standing room only. We are 30 minutes away from this meeting. The fallout continues this week after the release of the DEA's database revealing just how many pills flooded communities across the country. The warning signs are clear as day on the bottle. This stuff is dangerous to inhale, ingest, or even simply be around, let alone using it and abusing it like it's a drug. A backpack is another item that's on the list for several kids getting ready to go back to school, including ones like this that are simple, that even I used in school as recently as a few years ago. But now, next to backpacks like these on store shelves, you'll find some that come with an extra layer of protection. An initial cost estimates for this came in between $100,000 and $150,000. So council members are asking to outbid these and to see what else they can do. Now they have explored the option of painting a mural on this in the past.
Start of the holiday season, right, Josh?
We're officially here. A lot of kids, a lot of families here tonight, a lot of good dogs too. Well, Rosie, don't you fear, because I'm a little intimidated by cats too. They can be mean, especially Colleen's. But as far as dogs who are blind or have vision problems, what are there difficulties there when it comes to taking care of them? My goodness, can you believe it's already time to go back to school? Kids, summer is almost over, but it's not over quite yet, and our Colleen Campbell is outside enjoying this summer day at Sheet Lake's Crab Shack Kariba. Colleen, how's it looking out there tonight? Thank you so much for joining us. Tell us about your mission and what a typical day is like for you on the International Space Station. This is far more detailed than just the 4-page report previously released by the Attorney General. And just because of how much substance is there, how should the general public gauge the immediate reaction to this today by politicians, cable news pundits, and so forth?
The only national holiday we're celebrating today.
It's not the only national holiday. Yes. Our friends at Papa John's have been so nice to give us a pizza on National Cheese Pizza Day.
Yes.
Folks, this is my favorite day of the year.
I got a
Cheese
joke
Pizza
here.
Day.
What is a pizza maker's favorite song?
Tell us.
Song.
Slice, slice, baby.
Slice. I was going to make a joke, but it was too cheesy. One place where West Virginia did fare well in the rankings was affordability, coming in at 2nd in the country. Laura Jones has had type 1 diabetes for more than 40 years. Like roughly 30 million Americans with diabetes, she's seen the cost of the drug that keeps her alive skyrocket. The cost of insulin nearly doubled between 2012 and 2016. Even with insurance, the price tag can be crippling.
You could be talking, the cost of a car payment every month just to provide the medication that you need to stay alive.
Luckily, Jones has good health insurance through her employer to cut the cost of her insulin. This vial will cost her roughly $40 a month. Without insurance, it's $250. We are in Niagara Falls here on the Canadian side. You can see the United States right over here. Now, insulin north of the border where we are standing is 1/10 of the cost that it is right over there in the United States. That's why a local group is planning a trip here soon to save money on their life-saving medication. Delegate Barbara Fleischauer is helping organize the 300-mile journey.
A lot of us, including me, need to be educated about what a serious problem this is. I bet everybody in West Virginia has a relative who is either at risk or has diabetes.
The cost of insulin in Canada is cheaper largely due to its publicly funded healthcare system. The government sets the costs. You don't need a prescription here either. It's legal for Americans to buy insulin in person here, but not legal in most states to import them through the mail. Some states have implemented laws to limit prices or allow foreign imports. West Virginia isn't one. As for Jones, she's currently serving as the executive director of Milan Pushkar Health Right in Morgantown, working to make sure everyone in her community has quality access to health care, including insulin.
Insulin is not a cure. It is primarily a way to keep us alive and hopefully keep us healthy, but it's definitely not a cure.
For 5 News, I'm Josh Croup, keeping you connected in Monongalia County.
Hey!
You wouldn't know it from his swing
I didn't tell you that!
or his heckling, but George Hubbard is 92 years old. And every week, he hits the links at the Holly Meadows Golf Course in Tucker County with some of his longtime buddies.
Come back in there.
When he's on the course, he says his favorite thing to do is keep score. Why?
So I can cheat.
He's still chipping onto the green and working on his short game in his older years. The Navy vet didn't start playing until he was 35, but he's been at it for the past 57 years now, and still is as competitive as ever. It's this game that introduced him to his best friend.
Get one there. Get one there.
He's been playing golf with Dale Ruckle since the 1970s.
A little more oomph.
Ruckle is a retired Tucker County schools teacher and picks up George every week to play 9 holes.
He's been like a father to me. You know, he would do anything for me. I'd do anything for him. You know, that's what it's all about.
George watches intently each time Dale steps up to the tee, along with his other buddies, who say George's attitude serves as an example for us all as we reach the back 9 of our lives.
He's always has an uplifting spirit, so like that, keep active and do what you want to do.
When they made the mold, they threw it away when they made this guy.
Am I the captain?
As a seasoned veteran in this game and life, George has one simple takeaway from his long career on the green.
Friendship means more than playing golf.
For 5 News, I'm Josh Croup, keeping you connected in Tucker County. The old saying goes, we are all products of our environment. And as it turns out, our environment could directly influence just how long we live. Public health data reveals the average life expectancy throughout north central West Virginia varies greatly. And in some cases, to gain a couple decades on your life, all you have to do is cross a border. 5 News investigates Lifeline. All is well on a summer afternoon in Bridgeport, West Virginia. As it should be. According to census data, residents in this part of town bring in the highest median income in north central West Virginia at more than $80,000. Nearly every resident here finished high school, has a stable job, and reliable health insurance. An Associated Press analysis of federal data suggests all of those factors contribute to a higher life expectancy. Kids growing up here can expect to live to be 81 years old, nearly 6 years above the state's average. But if you hop in your car, take a short drive on Route 50 over to Clarksburg and grow up here, your odds at living a long life are significantly reduced. The median income in the poorest part of downtown Clarksburg barely scratches $25,000. Nearly 20% of residents didn't finish high school, nor do they have health insurance. Kids growing up here aren't expected to live to be 69 years old.
Healthy diet, activity levels, and decreased smoking. Those things alone could just change the health of the population.
Nancy Joseph is the Harrison County Health Officer. She says overdose deaths in Clarksburg contribute to lower life expectancy rates compared to the city's neighbors, especially in younger people.
Younger, by that I mean 20s as opposed to 40s or 50s.
West Virginia's average life expectancy is the second lowest in the nation, behind Mississippi. The two also top the list of the most obese states in the country, which Joseph says directly affects life expectancy.
Nobody wants to address it because they think of it in terms of cosmetics, and it's not cosmetics, it's health. And so when you have a third of your population in the obese range, all the other things are going to fall in with that. All the other disease states are affected by that.
We're in the part of Harrison County that has the lowest average life expectancy in all of north central West Virginia. Residents here in Salem are only expected to live to about age 63. But if we cross over into the eastern part of Doddridge County, residents here are expected to live 23 years longer to age 86. The statistics were somewhat surprising to Dr. Zachary Henry, a family physician at Salem Family Healthcare. He's practiced in Doddridge County before and found residents there often had jobs that required annual checkups.
So we did some tests, and every once in a while we find like their cholesterol be elevated, and I can talk to them about that. Even some of them needed medications, help prevent cardiovascular disease in the future, and it helps them.
But for those without insurance, preventing certain health issues can be challenging. The number of uninsured West Virginians went up between 2016 and 17, reversing years of progress since the Affordable Care Act expanded Medicaid coverage in 2013. As lawmakers continue their battles over health care, public health departments continue their battles on the front lines to address preventative health measures, with hopes of increasing life expectancy and decreasing health care disparity.
Medicine and society in general is very focused on fixing a problem once it's there. But ideally, we would want to prevent that. So I'd like, more federal funding and state funding, if you will, into preventive health care in that group that is traditionally under or uninsured.
We need to continue as a society to support public health, to make sure all patients, whether what age they are, gender, zip code, to make sure they get the best care that they deserve.
For 5 News, I'm Josh Croup, keeping you connected. If you want to see what the average life expectancy is where you live, we'll have an interactive map posted at our website at WDTV.com.